Hi, this is the second video in our discussion of pigmented skin lesions. We will start with prognosis, or what will impact the likely outcome of having a melanoma. Prognosis depends upon the thickness of the lesion. If the lesion is removed when it is less than 0.75 millimeters thick, the cure rate is significant. The depth of the lesion. If the lesion is allowed to extend to a depth of 4 millimeters, the cure rate is low. The site of the lesion. Prognosis is worse if the lesion is on the head, neck, or trunk. The individual's sex. Prognosis is worse for men. The individual's age. Prognosis is worse for those over 50. If it is an amelanotic melanoma, prognosis may be worse because of late diagnoses. Now, referral to a dermatologist is necessary when the primary care physician makes a tentative diagnosis of melanoma. If the primary care physician has skills in dermatology, the primary care physician may also render treatment. This is particularly important in rural or remote areas which do not readily have available trained dermatologists. Let's discuss treatment. Surgery is the mainstay of therapy for early stage melanoma and for the removal or resection of a melanoma. The initial biopsy may be performed by a dermatologist or dermatologic surgeon or a trained primary care physician, as we just discussed. Surgery to remove melanomas may be best done by a trained dermatologist using the following techniques. Simple excision. Thin melanomas are removed along with a small amount of non-cancerous skin at the edges. Mohs surgery, MOHS surgery. A small section of apparently normal skin beyond the visible melanoma is removed and looked at under a microscope. If abnormal cells are identified, another small section is removed. And this process continues until the cells removed no longer look abnormal. Wide local excision. This form of excision is used to decrease the chance of local recurrence. A wide incision, usually 1 to 2 centimeters, is made around the original melanoma site, and the tissue is sent to the pathologist for evaluation under a microscope. Sentinel lymph node biopsy. Now, lymph node status. Lymph nodes are small glands that work as filters throughout your body. They contain immune cells that help fight infection and destroy germs carried in lymph fluid. There are hundreds of lymph nodes throughout your body, and they are located primarily in the neck, armpits, and groin. If the original or primary melanoma has certain high-risk characteristics, your physician may want to examine your lymph nodes. This will help your doctor determine whether melanoma cells have traveled beyond the original site of the lesion. To check this, your doctor will perform a sentinel lymph node biopsy. The sentinel node is the first lymph node to which cancer is most likely to spread. If melanoma is found, the surgeon may remove additional lymph nodes to check for melanoma. The extent of lymph node involvement, as well as other factors, will help your doctor determine your stage of diagnosis. It is very important to find out your stage, as this information will help drive your treatment plan. If no melanoma is found in the lymph nodes, then it is likely that no additional surgery will need to be performed. Now, discussions of treatment with radiation and chemotherapy will not be part of our discussion here. That will depend upon the diagnosis and specialists treating you. Well, I hope this helps. Have a good day.